Good morning, everybody, and you're very welcome to our webinar today titled Mental Health in a New Working World, the Only Tools You'll Need to Lead. And we also have the launch of our Wellness Works, a framework for progressing mental health in the workplace. My name's Catherine Brogan, and I'm the Deputy CEO with Mental Health Ireland, and I'm delighted to be here this morning to be your MC. As well as hosting on this platform, we're also live streaming on Facebook. It's great to see that so many people have been able to join and that so many people have an interest in the whole area of mental health in the workplace. And I really hope you enjoy this morning's proceedings. We've got fantastic speakers and really good information that I feel if you listen from the start to the end, you're going to pick up an awful lot of information and some cool ideas as well. So I'm just going to run through some of the housekeeping tasks before we begin. So I'm sure you've all received the programme, but if you haven't, Georgina or Miffy will put it up there now into the chat so you have it. So what we're going to do first is we're going to give you a flavour of our workplace survey video, which we conducted in September. Then we're going to move into the official launch with Maria Walsh, who's our MEP and who has very kindly given up time today from a very busy schedule to be here with us. After that, we'll have Dr. Birgit Gerner, and she will do a presentation on the workplace mental health, and she does present the big picture around that. Very interesting presentation. Following on, Deirdre Kern and Steve O'Neill will be in conversation talking about the whole area of practical suggestions on how to improve workplace mental health. There's a break for 10 minutes, but if you come back about 2.5, 3 minutes before the 10 minutes is up, we have a lovely virtual nature walk that is ever so calming. And then at about 11:23, between that and 11:28, we'll have a presentation from Sean Russell. And then Sean and myself will have a conversation following that presentation. Now, there won't be question and answer sessions after Dr. Birgit and after Dr. Curran and Stephen's conversations, but both have given their email addresses and they'll be put into the chat box as well. And if there's any questions you want to ask, then they are going to be more than willing to answer those for you. There is also the webpage, which has just gone live this morning. And again, Georgina or Miffy will stick that into the chat box for you so that you will be able to access that after the event. And we're also recording the event so that if there's pieces that you really want to go back and check on, or if indeed if you want to send the link to anybody, you'll be able to do that. But it'll be there for posterity that you can check in on it. So our Twitter, very important piece, our Twitter. I'm the world's worst on Twitter, but I'm sure a lot of you are well used to Twitter. So our Twitter handle for today is hashtag WellnessWorksMHI. And again, it'll be put into the chat, but please feel free to tweet about this as the proceedings go ahead. I'll be popping in and out during the day just to introduce each section and then to go into conversation with Sean after his presentation. So before we go ahead, I'm going to just play a short video. In September 2022, just last month, we conducted a workplace mental health survey. We received over 900 responses back. And what we're going to give you now is not kind of the statistic piece, but we're actually going to give you the voice of the lived experience of people who responded and give you a flavour of what it is they said this meant to them. Thank you.
I feel as though if I'm overwhelmed due to work, that it's always attributed to my mental health challenge rather than the reality of what my day-to-day workload is like at that particular time. It makes me feel as though any weakness will be observed as declining mental health and almost as though I'm invisibly labelled as high risk.
I experienced burnout and it was affecting my energy levels, my behaviour and ability to function. I explained the effect this was having on me to my manager and they encouraged me to see my doctor and take time off work. My manager also supported me in coming back to work for a decreased number of days to help me recover.
I opened up and my manager was very sympathetic and supportive. They guided me to get support and they followed up with me afterwards. They guided me with making priorities so as not to be overwhelmed with my commitments.
I experienced workplace bullying and made an official complaint and experienced retaliation. I was placed on leave whilst the bullies remained in place with no action taken. Clarity around bullying behaviours and zero tolerance for behaviours is essential.
In one of my jobs, there was non-stop out-of-hours calls and emails, unrealistic deadlines, and a very critical approach and extremely poor staff morale. When I found myself burning out, they told me that maybe I wasn't suited to the industry instead of acknowledging that the working conditions were actually really poor. I work in the industry now and in a different job, but that experience knocked my confidence for a long time.
In one particular job I had, my manager was extremely supportive when I was going through traumatic events in my life. They made it easy for me to talk about this by being open and non-judgmental. They created a sense of normalcy around talking about how we were, which was particularly important at the beginning of the pandemic. She asked me how I was and when I need to take time off to support my sick family. She made this possible by allowing me to work more flexibly.
What worked well for me was being able to speak to my line manager, to explain my situation, and in return having a supportive ear and understanding. It means everything.
And now I would like to thank very much Maria Walsh, MEP for the Northwest, for taking the time out of her busy schedule of today's events to launch the Wellness Works, a framework for progressing mental health in the workplace. But before we do that, I'm going to just go through the reasoning behind where this came from. So Mental Health Ireland have been delivering training across a wide variety of businesses, schools, communities. And over the last 5 years, a pattern started to emerge around feedback we were getting, particularly from managers, needing to have some more specific knowledge and tools to help them support their colleagues who are experiencing mental health challenges. I think this is really positive that people are actually outwardly reaching out for this. So this was our starting point. So we looked at all the feedback we were getting, and then we looked at what was the latest research on risks to mental health in the workplace. And we set up a co-production group, and that is bringing all the relevant stakeholders to the table, all of them being equal, everybody having their voice heard. And what has culminated in that is the Wellness Works, a framework for progressing mental health in your workplace. The framework will support leaders and managers to protect and sustain the staff's mental health at work and be able to respond supportively when a team member experiences any form of mental health challenge. Doesn't mean you have to be an expert. It just means you have to be human, being able to interact and to be able to stop and listen and be able to signpost people and be able to put things in place similar to what we do when we look at what we put in place for somebody who has a physical health condition. Next, please. So the framework covers a number of areas. So it looks at the current shape of workplace mental health, the legal considerations, mental health as part of health and safety. And you'll hear a good bit around that this morning. Workplace mental health policies and how policies are important, but translating those policies into practice are what really counts. Risks and remedies. So for every risk, there's a solution. So looking at that and seeing how we can incorporate it and make it an integral part of all the policies that we have in our workplace. And then supporting colleagues who may be experiencing distress in the workplace. And the next slide, please. So the framework then recommends 3 key actions. So the organizations carry out a psychosocial assessment on their workplaces. That they work together with the staff. That's key, because if you work together with the staff, you will get a policy that everybody owns and everybody feels that they have contributed to, and it's more likely to succeed. And then that managers be trained so that they can facilitate conversations around mental health and mental health challenges with the team and with their supervisors. And of course, this is for managers as well. So now I'm going to hand over to Maria and to launch this strategy. Maria was elected as the member of the European Parliament for the Midlands Northwest constituency at the 2019 European Parliament elections. She is the youngest MEP in the European Parliament and was born in Boston, but is a real Mayo woman, I have to say. Her heart is in Mayo. And she graduated from the Griffith College in Dublin with a BA in journalism and visual media in 2009, and went on to have a career in television production and creative management, working in Dublin, New York and Philadelphia. We have gotten very close to Maria because Maria has a really strong passion for mental health and is a very strong advocate, not only in Ireland or Europe, but across the globe, in being very openly and outwardly talking about mental health being absolutely paramount for each and every one of us. So thank you very much, Maria. Thank you for launching this strategy.
Thank you very much, and I'm really honoured to be here. And thank you, Catherine, for your very kind words and for always keeping me updated on what is happening, and really making sure that I'm understanding of the lived experiences and how that impacts our everyday lives and in our business. And congratulations to you and your team and everybody involved in the report and the paper. I'm super honored. But as Catherine just shared, just for everybody else who's connected, and great to see so many on a Friday morning here. My name is Maria. I'm delighted Catherine minded my mental health today by reassuring everybody that I'm the youngest Irish MEP, a record I hope gets broken by a couple other young people in 2024 elections for sure. But one of the issues from a personal side on why I got into politics and why mental health has been at the very fore of everything I do within the political realm, both locally and nationally, and of course where I sit in the European Parliament, was because I seen firsthand the impact that poor mental health services and ultimately the stigma and discrimination that we have, that legacy piece that we have around mental health in this country, but also across Europe and ultimately the world, when we talk and we look at mental health. I am from a small village called Shrule, just in South Mayo, just on the border, and within a very short distance, a couple of miles even, we have lost multiple people through death by suicide. And from a young age, I could see that. I couldn't understand it, but I could see it. And I could certainly see the difficulties peers and adults had in discussing the mental health and why issues and challenges were continuing to grow, but yet nobody was speaking about them. From a work perspective, earlier this year, I led a file on titled Mental Health in the Digital World of Work, very apt to today's launch, which focused on the impact that teleworking on employees is having. And I also put in employers too. We don't have a blue book, we don't have a blueprint even to say how employers should handle bar this report and what you're launching today. So I think it's incredibly important as we look back on COVID and what it has taught it in the world of work and our mental health. It's important that we see the learns, and they're never failures. We're a win-learn mentality, and that we grow from that. My colleagues in the European Parliament on that report, and it was very cross-party, voted overwhelmingly in support, which was really reassuring for me, because mental health is not seen as what we call a competency of the European Union. It's seen as something the member states handle and work in on their own. But I think for the 208 people I see on this call, I think you and I all know that when we talk about business, when we talk about the economics, when we talk about even what people are living through now, you and I, in terms of cost of living and war and the pandemic that is still in our community, then how can we not include mental health as a competency of the European Union when it's driving such other change? But it really resonated with me what impact we could have as a collective parliament for our mental health. So we continue to press on and got that support for that report, which fed into other work that were still ongoing. There's no denying that a person's mental health is affected by the workplace. It's affected outside the workplace, and within that comes into the workplace. And each year, approximately 12 million working days are, I don't want to use the words lost, but are certainly not celebrated due to stress, burnout, anxiety, and depression. And the list is endless. Although we should avoid reducing the impact of an individual's suffering to a number of a monetary figure, it is very clear that poor mental health and a mental health challenge is costing businesses and could impede productivity. We have reports saying that. But ultimately, it's how we are celebrated as an individual, and what we bring to the workforce and to our community is something that I think often gets lost in the political narrative. So I certainly don't want to get lost here for me. Each year, businesses invest in infrastructure. We've seen businesses, both large and small, change overnight due to COVID and our work of working online more so than in person. We see businesses spend money on upskilling and manufacturing and purchasing of stock. But I must say it's quite rare that we see businesses invest in mental health and well-being of their employees with the same purpose and vigor. Investment in employee mental health is a worthwhile investment in business, and I hope you all would agree with me on that. And time again, studies and reports show that employees who feel their mental well-being is being cared for at work are more productive and are generally have a more positive attitude towards their work, their management, their colleagues, and ultimately are taking that back home into their community also. The report being launched today calls on employers to treat mental health in the same way they approach physical health and safety. A directive coming from the European Parliament many years ago, and it's only a miss that we did not include mental health there, but we have time to do it now. And this is what this report is really calling for, I believe, and certainly something that I will be working with Catherine and her team on. In almost every workplace, there are health and safety procedures to make sure everyone is safe and that the physical injuries are prevented. However, we can see from both personal experience, the lived experiences that Catherine has shared already and will continue to share throughout the day, and published research like this report and various others, that mental health challenges or injuries of the mind or the invisible challenge and the invisible disability can have such a negative effect and affect as a physical health also. Often, the cornerstone of traditional health and safety procedures in the workplace is training. And drawing on my own experience and the findings within this report, I believe this is the best way forward for mental health safeguarding in our workplace. We need training aimed at all levels, employees, managers, boards, CEOs, and new interns. The list is endless. People need to know that they are the same page when it comes to mental health. For a long time, employees have been expected to protect their mental health, I believe, in the unwritten rule or the silent conversation that we often have with people within our workplaces. But if the workplace culture environment is not conducive with promoting mental health and well-being, then no amount of personal resilience can protect an employee from the risk of mental health challenges within the workplace. Workplaces can serve as such an important vessel, as does the primary, secondary, and third level does to our younger generation. The same to vision when we look and talk about our workplaces. It is such an important vessel for destigmatizing, the word doesn't want to come out, conversations about mental health. Given adequate training and support, management can really lead in promoting positive conversations about mental health within our workplaces, creating a space where employees feel safe in the knowledge that they will not be judged or discriminated against for opening up about their mental health difficulties. And I can say I have met multiple employees who have shared, believing the space is safe to share, and then perhaps taking a mental health break for a short period or a little bit longer. And went within their career, within that same company, when they went to apply for a promotion, were held back because of their sharing of their mental health challenge. That is absolutely not okay. I want to give an example, another one. If an organization has a dedicated mental health policy, it would make it a lot easier for an employee to ask management for time during the day to attend therapy or counseling or share with other lived experience individuals who they feel safe with in sharing and getting the support that they need within that time frame. The benefits that one session could potentially have for both the employee and ultimately the organization far outweighs the loss of a single work hour. And it should not be taken as a lunch hour. It has to be separate. I really believe that, and I hope you would also agree within that. Knowing that the option is there to prioritize their mental health and well-being at work goes a far long way in the destigmatizing of mental health within the workplace. It is a simple request and task, and something I would hope businesses would certainly lean on and celebrate. There's no denying that we live in a very, very stressful world. And I'm not saying that as someone who works in politics in the last 24 hours have certainly served some trials and tribulations, but our worlds are stressful, both online and offline. And this has spilled over into our workplace. Working hours are getting longer, and for some, the lines between work and home are getting increasingly blurry. There's an ever-increasing amount of risk to mental health appearing in the workplace, between blurred lines, between long hours, as I've just mentioned, between tasks not being set to the adequate time frame that they can be, and simply overloading. The only way to mitigate risks is to identify them, to call them out, and to come up with a proactive plan to reducing such risk. In my belief system, and I think from this report, I take the three-pronged approach: education, identification, and probably the hardest one of all, the implementation. So within the education lens, and we're moving into, on a European level, an EU of skills and training next year, announced by the President of the Commission in September in her State of the Union. So this is something I think Catherine and the team here can lead into, and I want to be a champion for that. When we look at education, to learn the skills and tools for having open, destigmatized conversations about mental health, and for spotting the signs of somebody who may be experiencing mental health stress or de-stress. And I cannot convey enough how important it is that we are all trained in suicide prevention, we are all trained in language, and ultimately we're all trained in listening. Surface level listening is not serving us, and therefore we need to show up for ourselves and for our community and our workplace, or for our families, and the list is endless from that, with those skill sets. And I think the workplace is the best way to really develop those for people who've been in the workplace for a long time, or those who are entering into the workplace and need the skills in order to have every opportunity within their work and career life. Identification, and what I mean by that is the risk assessment element. Utilizing mental health education to identify the risks mental health well-being that exists in the workplace and organizational culture. I would be hard pressed to say, everybody put up your hands, who has experienced or who hasn't experienced some sort of mental health conversation, be it verbal or otherwise, within their workplace. It's unknown now, particularly after the pandemic. So therefore, when we look at identification, we have to make sure it's organizational culture, it's in our workplace, and we are all building towards that. Finally, as I mentioned, the implementation piece, the hard piece. Combining both education and the risk assessment to implement, I really believe a mental health policy in the workplace serves the employer, the management, the employee, and the future employee the best. And this can't be like the diversity and culture pieces that I've met with some businesses who say, around the marriage equality, we built this document and it's great, and people know where to go. That's not good enough anymore. We have to be able to live it within our values, within our culture, and really implement a mental health policy within our business framework. In an ideal world, we would not even be needing to have this conversation or the hard work that this report has delivered. But you and I both know we are far from utopia when it comes to everyone understanding and having the best care practices for their mental health and well-being. So what we need to do to get to that utopia is this. We need to make sure mental health well-being is growing and we're learning from it. As I said in my outset, it's a win-learn mentality. We are constantly learning. When we talk about in our workplaces, in our education systems, in our communities, about that lifelong learning piece, it's not about taking on a new skill. It's about growing as an individual and ultimately being able to serve and protect other individuals that we come into contact. And the workplace is that vessel, as I mentioned. Mental health is not a new concept. As I also mentioned, we have a legacy here, quite a negative one in Ireland, and something that I truly believe we need to change for future generations. But it is a relatively new conversation. So it's absolutely 100% understandable that we do not have perfect attitudes or policies yet to understand it. But this report certainly goes and moves us all in to that work, and living and learning and understanding from those with lived experiences is incredibly important for us to navigate through this. We can utilize resources such as the one launched today, and one that I'm super proud to be associated with, to educate ourselves on best practices and implement the knowledge in our personal lives and our workspaces. And finally, may I just say, I cannot stress enough the lived experience is essential in how we learn and grow here. And to say to any employers and in future employers on this call and those you might come into contact with, our second leading cause of death in the European Union for 15 to 19-year-olds is suicide. Our second leading cause of death. When we look at the workplace, that is our future employees, management, and employers. So we have to get this right now in order to best serve our future generations and those that are desperately in need of help. We all have mental health. It's everyone's business, and therefore it belongs in this conversation. I'm super glad to be a part of this launch today, and grateful that you gave me so much time to share. And as I said from the outset, Cogorgicus, Catherine, and to all the team, and any work I can do within the mental health space in the European Parliament or at national level, please let me know. I'm here as a friend. I'm here as someone who champions mental health. As I said, we all have it. Let's make it everyone's business. Thank you.
Maria, thank you so much for launching our Wellness Works, a framework for progressing mental health in your workplace, and that's in our workplace. Some of the key takeaways from that are literacy. The language is so important. The language that we use around mental health and mental health challenges is so important for everybody. Listening to hear, not just listening at that top level. And the third is the inclusion and the value of lived experience in anything that you do in relation to a framework. There is a very quick question, and if you can give me a very brief answer, it's just in the box there, and it just was Maria, in relation to
directives.
Yes. Is there going to be anything around rolling out workplace mental health frameworks from an EU context?
And sorry, and I should have included. In short, we are working on, the President of the Commission included a mental health citizens engagement. What that means is simply what we're having here in Ireland, what we had in before referendums, experts like yourselves coming together to making sure that EU mental health strategy is working. So a mental health strategy is en route, a citizens conversation is en route. I'm looking to bring stakeholders like yourself and every EU minister or those who have competency within the mental health space to Europe in earlier half of next year. We're still driving on an EU year dedicated to mental health, but skills and training got the appointment for 2023. So we're working for 2024. 2024, and ultimately a psychosocial directive at workplace too is on the works also. So there's a couple of moving pieces. Ultimately, we're not moving as fast as I would like, but we're certainly moving in the right way. So I will come back to you, Catherine, and maybe you can disseminate the information. I can make a one-pager to see where we're going. And then anybody on the call who has ideas, thoughts, or suggestions, or even to say, hey, you're not working fast enough or hard enough, come at me and let me know. Ultimately, the conversation has to be all of us together. Otherwise, we miss people. And certainly, I don't want that to be the case. So thank you.
Thanks very much, Maria. Appreciate that you've got another meeting to go to very shortly. So really appreciate your time, and we'll be in touch with you next week and see you in person then. Just to say, as we're moving on now into the body of the presentations, that if you keep in mind, each presentation is going to build on the other. And then by the time we get to Sean, we'll hold the questions and we'll try and answer as much as we possibly can at that point. Is that okay? So the next presentation is from Dr. Birgit Gurnier, and she's a senior lecturer. She just recently retired. She's a senior Mentup researcher. That's the mental health promotion intervention in occupational settings. And she's an external expert reviewer of the forthcoming World Health Organization guidelines on mental health and work. She's the founder of the Master's Occupational Health Programme at UCC Cork, and she's an expert in occupational health and stress. We're going to hand over now to her presentation. Now, her presentation is absolutely brilliant, and I think it'll give the foundations of everything that's going to come after it for the rest of the two presentations. And I've had the pleasure of seeing the presentation, so I was quite blown away by it myself. So she explains everything about what she's going to talk about in it. So I'm going to just ask Maciej to put the presentation on here now. Thanks very much.
Good morning. I'm Dr. Birgit Greiner, and I'm delighted to be asked to present here to you during this webinar on workplace mental health. Now, in my career as a UCC lecturer in occupational health and as a scientist in occupational health, I've been passionate about researching workplace mental health issues, specifically also the impact of work stress on health. Now, I will give you a very broad picture and start with the global extent of mental health issues in the workplace, owing to the vast importance of this issue all over the world. I will then look specifically into the aspects at work that may aggravate a mental health condition or even support mental health and or even prevent mental health issues from arising. And this would be the perspective of the psychosocial risk management. The centerpiece will be workplace mental health interventions. I will introduce with a case study and hope to keep you engaged. In this case study, things went awfully wrong. And so we will relate those issues maybe to your own experience. And the centerpiece are then the WHO Workplace Mental Health Guidelines, which were just published last month, and which provide guidance for practice, actually. And I feel very fortunate that I have been engaged as an external reviewer to these guidelines. We will clarify roles and responsibilities of different stakeholders in mental health interventions and what I call the power of good implementation. How can we make this work? Now, the starting point is a call for global action from the World Health Organization and the International Labour Organization. They call for concrete action to improve mental health in working populations due to the vast majority of, or the vast impact mental health has on workplaces. So the situation is 1 billion people living with a mental health disorder in 2019 worldwide. 15% of working age adults have actually a mental disorder. And if you consider 60% of the population is employed, these are large numbers. As you see here in the infographic, depression and anxiety disorders are the leading disorders in terms of prevalence, and sadly also suicide is a big issue with over 700,000 people yearly dying by suicide. Now, this has vast impact on costs for society and for businesses. Now, the impact of COVID-19 has triggered even an increase, and the World Health Organization estimates an increase of about 25% in the prevalence of anxiety and depression worldwide. In a way, COVID only amplifies the societal issues that have been going on in relation to mental health and work. So increased unemployment in some sectors, unprotected working conditions, which are risk factors for mental health, discrimination and inequality. The gap is widening. And disclosing mental health issues is still a taboo in many work settings globally. And this is why we are here to talk about this, how we can make a change. Now, the main messages of my presentation right at the beginning: employment is good for mental health and well-being. However, the way work is managed can influence mental health negatively or positively. Now, employment can give us a lifeline. This is why it is good. We know that from studies showing on unemployment and health, how health can, especially mental health, can deteriorate after losing a job. Everybody in the organization can contribute at all levels, managers and workers. Strategic planning is important. That's the power of good implementation. Healthy organization rather than the health in the organization. And prevention is core. I think we can do more than just helping workers in need with mental health issues, but we can go beyond that and actually also focus on prevention. So these are the main messages, and I will show them at the end of my presentation again, and hopefully some of these will resonate with you. Now, as I mentioned, work can be a lifeline for people with mental health issues, and it secures an income, it provides context, it allows you to apply skills and personal development. It gives a structure to the workday, very important for people with severe mental health issues. It allows for recognition and a meaningful contribution in life. And when I talk about lifeline, I mean it keeps us connected to work and life. As my colleague Ella Arendsman and myself, we just highlighted in an editorial to the Scandinavian Journal of Work, Environment and Health. It's also important in the context of suicide, the lifeline that work gives us, but also for healthy people and people affected with other mental health issues. So work has an important role to play for mental health in terms of prevention or protection of our mental health. So mental health, what do we mean by it? There are different perspectives. Some of them define it as an absence. So it means the absence of a clinically defined mental health disorder or the absence of a subclinical condition such as burnout or emotional exhaustion. And that's important to highlight. It can be also defined as a presence of a positive state. So mental health is more than the absence of just illness and disease. It is actually a state of positive well-being. And this is where I'm coming from in my presentation here. Now, how mental health is impacted really by many factors. It's not just the workplace. So when people come into the workplace, they already bring a lot of some vulnerabilities with them. They may have developed during childhood, during their life. There may be genetics, there may be traumatic life events or experiences such as abuse, physical abuse, for example, sexual abuse. There may be also experiences with social support and previous relationships. They may be good or bad. certain experiences with resources and social resources that you can tap into. They may be more or less, and coping skills people acquire during their life. And this all now meets working conditions, and working conditions can be more or less supportive. And that's the good news. They can be changed and modified. So on the right-hand side, you see more like the stress factors, the negative factors, which may aggravate an existing vulnerability or even cause new vulnerabilities, such as job insecurity, lack of control in the job, isolation, excessive demands, very high workload, workplace violence and bullying, or even traumatic work events. Now, this brings me to the definition of what are psychosocial risk factors or psychosocial hazards. They have been defined as those aspects of the design and management of work and its social and organizational contexts that have the potential for causing psychological but also physical harm. So tackling these psychosocial hazards can have a preventative effect on mental health problems, and there's a lot of opportunity here for organizations to really make a difference. Now, these psychosocial risk factors have been classified into 6 categories here, and also conceptualized into management standards for practice. So the 6 categories are job demands, job control, social support in the workplace, role, social relationships, and how change is managed. And here to the right-hand side, you see the positive side, kind of the workplace management standards as formulated by the UK Health and Safety Executive, but also by the Irish HSA, Health and Safety Authority. So in terms of demands, a manageable workload and alleviating high pace and providing flexible hours has definitely a positive effect, and it's something to strive towards. Also in terms of job control, to give people a certain amount of say on how and when to do tasks, and to encourage to use skills and initiatives, and give participation opportunities. In terms of social supports from supervisors and peers, it's a matter of providing rewards and resources, recognition for people, what they do, support for their personal development, and concept concerns that are dealt with if people come up and have some suggestions or concerns. Role in the organization needs to be clear, with clear expectations and what people are required to do, and ensure that there are no conflicting roles. Social relationship means that there are structures for developing a positive work environment where people support each other, but there are also implemented structures in the organization how to handle conflict and how we deal with unacceptable behavior such as bullying, harassment, and violence. And change means that there should be transparent and timely communication about planned changes in the organization, and also worker consultation and soliciting impact on changes, and the provision of access to relevant support during change periods. Now, there is a whole strategy which has been developed by the Irish HSA and the UK HSE in terms of risk assessment and management of psychosocial risks at work, similar to physical risks at work, such as noise and dust. So in a way, what the risk management circle is about is psychosocial risk factors, stress factors at work can be assessed for risk to mental and physical health by health and safety professionals as any other hazard as well, and prioritized for action and put into a safety statement. And managed with a focus on tackling at source. So rather than providing help and counseling, which is an important step to offer for stressed people, we should look at the source of the problem. Also identify training needs and capacity building. The evaluation then should be evaluated and modified if necessary. And it's suggested to do regular monitoring of work stress factors, even if everything seems fine. There's also relatively recent ISO standards on psychosocial risk assessment and management, because it can be integrated into existing health and safety management systems and can be used to prevent work-related injury and illness, including mental health, and to promote well-being at work. It's based on the 3 pillars to get active involvement of workers, commitment of management, and capacity building in psychosocial risk management. And capacity building in this area is very relevant, because often when I talk to my students, some of them are supervisors or professionals in health and safety, on occupational health, on HR. We need capacity how to do a psychosocial risk assessment. And this is why at UCC we developed the MSc in occupational health with a focus on this capacity building. There's also a legal mandate. It's not just a moral mandate to employers to take care of mental health and psychosocial risk factors. The European Council Directive mandates the employers to ensure workers' health and safety, including mental health, and addressing risks as source, and also mandates that employers must adapt the work to the individual in relation to the design, but also the production methods and the organization of work. And last but not least, and I find that a very important point, develop a coherent overall prevention policy, which covers technology, organization of work, working conditions, social relationships, and so on. And that's particularly important for mental health interventions, which I will outline later on. So at the heart of the EU legal frameworks and directives is prevention as core, including prevention of mental health problems, risk assessment, tackle risks as source, consult with workers, and do long-term prevention. Here's an example of a risk assessment tool with implementation guidance. That's the Work Positive tool developed by the HSA in Ireland. It is based on the risk management standards. And what I particularly like about this tool is it includes a questionnaire that can be easily used for risk assessment in organizations, but it comes also with implementation guidance. And it suggests to first prepare an organization to do this, then to measure using that questionnaire, to develop an action plan that guides you through, and also how to review your results and benchmark your organizations against other organizations. So what does it mean to tackle stress factors at source? I just pick 2 examples in terms of work control. One may consider participatory approaches to work design to give workers the opportunity to input their knowledge and expertise, input into scheduling to alleviate some of the load, flexible working arrangements, frequent and open communication within an organization, and job rotation or enrichment, especially with very monotonous jobs. Relationships can be, for instance, tackled by policies and procedures to prevent violence, systems for investigating and dealing with incidents, training for line supervisors, how to actually support good relationship and to follow up if something negative happens, and opportunities and structures for peer support, all integrated into structures in the organization. Now I'm coming to workplace mental health interventions and what we can do and what works. And I want to start with a case study. Maybe you have experienced something very similar in your organization. So let's envision we are in a large construction company. There is a very engaged HR manager who wants to promote mental health. She invites a medical expert to give a talk about mental health, to foster mental health awareness and knowledge. There's a Q&A session afterwards. And she also wants to bring forward the establishment of a peer support network. Now, and that's what happened, 15% of staff participation. Some of people left the talk earlier, and only one signed up as a peer support volunteer. So the question is, was that a waste of time? And what would you say are reasons for low participation, and what could our HR manager could have done better? So I wait a couple of seconds here just that you can reflect on this question and ask yourself what you could have been, what could have been done better. Okay, so this is a selection of a few answers that you may have thought of. I'm sure you have many more aspects. You may have thought of the reason was an inappropriate program, a poor quality talk, irrelevant information, or information was even not tailored to the construction industry. Also, the context may have been not considered. So the timing of the talk or the location, the dispersed workplace sites in the construction industry may have made it very difficult for people to attend. Also shift work problems, not considering night shift workers, and high work pressures that don't allow people to show up for these kind of talks. It could have been also the implementation, the poor marketing or information of this program, lack of a long-term strategy, really. Maybe it was seen as a once-off talk, but nothing happens afterwards. And lack of resources and no visibility of senior management. These may have been all reasons, and we're going to look into that more in detail later on. What are the issues here to make a difference? Now, what we have to consider in terms of workplace mental health interventions is it's very difficult to do because of the stigma. Many people still think mental health is a weakness of character. Depressed people are unreliable at work. They shouldn't be hired in the first place. Depression cannot be treated. You're born with it. There's a risk of evoking even or making worse suicidal thoughts in a person if you ask about mental health issues, and people just need to pull themselves together to come over it. And this is the barrier of stigma which needs to be overcome in organizations by developing a stigma-free work environment. So one first step in preparing an organization is actually to address those issues in the first place so that a workplace mental health program can take momentum. Also, what we need to consider is workplace mental health promotion has become a multi-million business. If you Google workplace mental health promotion, you get many providers and with different programs offering anti-stigma interventions, mental health first aid, counseling, wellness, total worker health. So how in an organization can you decide what's good? again, that's something where the WHO workplace mental health guidelines can guide us a little bit in terms of finding criteria. What is a good program? But as a particular tip from my side is use those programs. There are lots of good programs out which give you implementation guidance. So tell you how to actually implement it in the company, who needs to get involved, how do it step by step, because many providers will promise you a quick fix. However, workplace mental health promotion and interventions need time to develop and have an effect. So what are the WHO guidelines on mental health at work? They are evidence-based, and at the end of the guidelines, you will find references to the relevant systematic reviews and meta-analysis that this review is based on. It's a milestone guideline, I feel, because it really addresses its salience of the issue and pulls together the expert opinion of expert in this field worldwide. And as I said, I was very proud of being part of this process. The recommendations include organizational level interventions, meaning tackling the issues at source. Management training, very important, because managers are often in the position sandwiched between workers and having to do their routine work. Training workers, very important. Individual intervention delivered at high-risk individuals, returning to work issues after absence and gaining employment for people living with mental health conditions, and also a paragraph on screening for mental health. This was accompanied by the ILO policy brief with support for stakeholders to act, also government recommendations and recommendations for employers and workers. First of all, WHO suggests what works is, first of all, prevent risk to mental health at work, tackle its source, protect and promote mental health by strengthening managers' capacities. So that's the positive side, bring out the strengths and the capacities in managers as well as in workers, and support people with mental health conditions to thrive at work. And often people only think about the support aspect, which is very, very relevant and important to support people with mental health issues. But I was delighted to see that the prevention aspects are highlighted here as well, because the workplace has a lot of potential to prevent certain mental health issues from happening in the first place. So to the different aspects here, the prevention aspect uses organizational interventions, usually universally delivered to everybody, to reshape working conditions, cultures, and relationships. And what's important here, often managers say, oh, it's just an expensive add-on. But what's suggested here from the WHO is to embed them into existing or systems, and to prioritize the collective measures based on a risk assessment with meaningful involvement of worker representatives. Protect and promote is the second aspect, the positive aspect, through training and interventions that improve mental health literacy and strengthen skills to recognize and act on mental health. Empower workers to seek support. So there's, on one hand, the manager training and supervisor training for mental health. That includes interpersonal management skills such as active listening and open communication, skills to promote an inclusive and supportive work culture, and advocate for action on mental health, and also understand psychosocial risk, and skills how to prevent and control them, and ensure the worker access to support. And a lot of, as I've already said, capacity building has to be done here. Worker training in terms of universally delivered in the entire organization, delivered mental health literacy and awareness training is important to build that anti-stigmatized work environment and to change attitudes and reduce stigma. And this should be in kind of accompanied by individual interventions for workers with distress. The health organization, World Health Organization, particularly based on the evidence, recommends mindfulness training and CBT-based training and problem-solving. CBT-based means cognitive behavioral therapy-based. This is also for universally training recommended. And support workers with mental health conditions to participate fully and really equitable in work. And that can be returned to work programs and reasonable accommodation with phased entry. In summary, I try to think of it in terms of healthy work, where health is ingrained in the structures of the organization and the work processes and the safety structures, rather than thinking health promotion as an add-on to the organization, which can be done or not be done and not ingrained in the daily procedures. Now I want to introduce briefly the Mental Project, which I have been heavily involved in over the last few years. It's a European project, runs over 4 years with 16 partners in the EU and also in Australia. And it's a project where we, with the aim to improve mental health and well-being in the workplace, mainly in SMEs, to develop, implement, and evaluate these interventions using very robust evaluation methods. It is a multi-level approach with manager supervisors and individual worker interventions. We focus on construction, healthcare, and information and communication technology sectors, and there's ongoing opportunities to participate. Here are the levels of the workplace mental health interventions. It's the individual level, where we foster awareness, information, help-seeking communication, peer support, and coping skills. Then at the supervisor-manager level, the training and awareness skills to approach individuals and also to conduct psychosocial risk management. And then the organizational level, which is universally delivered in relation to work design, organizational changes, policies, and structures. Now I'm going to come to what I call the power of good implementation. And what works really here are implementation principles from the evidence. Visible leadership is actually core, with clear responsibilities, accountability, and visibility of senior management, and clear progress communication. Secondly, often workplace mental health interventions are underinvested. So investment is necessary in terms of secure funding sources, because mental health promotion costs money. However, it will be returned later on with savings to associated costs for mental health. Important for investment is the long-term perspective, because mental health promotion doesn't happen overnight. It should be integrated and tailored, so integrated into the work processes, the health and safety processes. Then it can be more effective and use available resources in a good way. Tailored to the needs of the population, and that can be done through a risk assessment or needs assessment. What is actually priority here? Participatory include the lived experience of people with mental health issues and lived experience in the workplace, solicit input, match to the local context and the culture. Construction industry is different from healthcare, and a mental health promotion project needs to operate on different cultural levels here and uphold the rights of the individual workers, protect the vulnerable. It's a very sensitive issue, and confidentiality is of the core to build trust. Let's go back to the mental health intervention study at our HR manager. He or she tried it on her own without a long-term perspective, possibly. So it was a first good step, but it needs more development in terms of preparing the organization for the peer networks and for dealing with mental health issues. So it may have been a good first step, which needs to be followed up with a second step and with clear dedication of senior management and a long-term perspective, which is actually articulated and clearly laid out, and possibly a few contextual factors prevalent for the construction industry also needed to be considered here in that scenario. Now I go back to my main messages. Employment is good for mental health and well-being. I think we've seen that. It can give a lifeline, and a safe and healthy working environment actually supports health. Issues should be tackled at negative issues or work risk factors should be tackled at source if possible, based on a good risk assessment. Prevention is really key here. And we can that way go beyond offering help to those in need, but being a healthy organization rather than just health on top of an unhealthy organization. Everybody in the organization can contribute. Managers, supervisors are core because they have to deal with people and they have to deal with the working conditions and can be a change agent actually in the organization to make a real change here. Strategic planning is really important. The power of implementation and long-term strategy and planning, and a healthy organization rather than health in the organization. So my concluding remarks are building psychologically and physically self and healthy workplaces really benefits everybody, workers, business and society. And you can be a change agent in your organization, and I want to encourage you to do that.
And thank you very much to Dr. Birgit Grenier for that wonderful presentation. Now, I know you might be sitting there going, oh my God, there's so much in that. It's quite overwhelming. Where are we supposed to start? And indeed, all organisations, big or small, are in that situation, including ourselves in Mental Health Ireland. We're looking at this as well, and how we can be better at what we're doing to look after our mental health of our employees across the organisation. But there was a couple of standouts there. One is culture. You heard again how language kept coming up, that whole literacy piece, how we speak about mental health. How can we destigmatize how we speak about mental health so people can feel more open around having the conversations around mental health? The importance of organisation commitment. I sometimes look and think, if we were building a house today, if we didn't put in solid foundations, the house is going to crack and the house is going to fall. Whereas those foundations include promotion. Now, for me, promotion is way upstream, way before anything happens. So what are we doing to promote mental health within our workplace? Then the next is, what do we need to put in place that prevents the workplace having an impact on our mental health? Then moving into the interventions, what can we do when somebody does experience a mental health challenge at work? What can we do in that instance? And the last is the postvention, which can be when somebody does have to take time off work because of their mental health. When they come back, what do we need to have in place? What supports are there? Again, I'm going to emphasize, you do not have to be an expert. Everybody has a part to play in this. But if we approach it as a team, big or small, put in the foundations, destigmatize the language, you'll find straight away you're already impacting on people who work in the organization. And just one more thing to say, if you have mental health as a positive concept, it's totally positive concept. Having a mental health challenge doesn't mean that you're not haven't got good mental health. You can be perfectly mentally healthy even with a mental health challenge. So think about that one. And just to say as well that Mental Health Ireland will be working to develop a workshop to support the translation of the framework around workplace mental health into practice. So if you link in with our training department on that, we'll keep you updated on it. And what I'm going to do now is I'm going to move swiftly onto the next presentation, which is a conversation around workplace mental health. And that conversation will be with Dr. Deirdre Kern. And Dr. Deirdre Kern is the Programme Director of the Masters in Human Resources in the University of Galway. She's the Vice Dean for Diversity, Equity and Inclusion in the College of Business, Public Policy and Law in the University of Galway. And she will be in conversation with Stephen O'Neill, who's the Distribution Business Manager Ireland for Hewlett-Packard Enterprises. And they're going to look at, the practical suggestions on how to improve mental health within our workplace. So thank you very much. And I'll just push it on to that presentation.
Thanks for joining us today. We're here in University of Galway. My name is Stephen O'Neill and I work for Hewlett-Packard Enterprise. And for the last few months, I've been volunteering with Mental Health Ireland as a workplace liaison person. And here we have...
My name is Deirdre Kern. I'm an academic here in the business school in the University of Galway, and I have been working here for more years than I care to acknowledge, 25 roughly. And as part of my role here, I am Vice Dean for Diversity, Equity and Inclusion. In terms of what we understand about mental health in the workplace, for me, I see it as a continuum. Okay, so at the extreme left of that continuum, you have the total Zen Buddha, like somebody who is totally in harmony with the world, and you'd probably have to be a monk living in some remote location to be. I don't think anybody in our audience will be feeling that they're at that extreme. And then you have stress, which is an interesting concept because stress was originally a concept that was adopted from engineering, and the definition of stress is when the demands placed on an object outweigh the ability of the object to resist it. Okay. And so as humans, we suffer from stress, but stress to a certain extent can be good. So that's referred to as eustress. You need a certain amount of stress to improve your performance. And so stress can actually positively impact our performance up to a point. And once it goes over that point, we then are in the realm of distress, where it is negatively impacting our performance. And then beyond stress on that continuum, you have mental ill health that I would see as caused by external circumstances. Okay. So all of us in our life will have mental health challenges at some point, and sometimes it's caused by just how awful the world is. I mean, I've stopped reading newspapers, but you only have to look at Twitter to realize how terrible the world is. And that has got to have an impact on our mental health. And then there's things that happen like, God forbid, but the loss of a child or something, and that triggers a mental health episode. So there's the externally created mental health, ill health, and then there's the internally created. So where people develop, some kind of mental illness, whether it's anxiety, depression, schizophrenia, some kind of psychotic episode. So for me, it's a continuum from the extreme right to the extreme left. And what we have to try and do is push towards the good side of that continuum. I think resilience is an important, concept, because resilience is our ability to resist the negative impacts of stress and to stop it from moving into mental ill health. I did want to mention learning zones because I think that's a nice kind of way of thinking about it.
What do you mean by learning zones?
So learning zones is like if you think of three circles, a large circle, a smaller circle within that, and a smaller circle within that. And the small circle is your comfort zone. So if you're in your comfort zone in the center and it's comfortable, it's familiar, it's pink and fluffy, and you've got this, you're in control of this, then you're in your comfort zone. The next zone then is called the learning zone, where you're pushed out of your comfort zone a little and you're more challenged than you normally would be, but it's an ideal zone for learning. Pushed out of that, you're into the fear or the panic zone. So now you're too challenged, you're too pushed, you're too stressed, you're too, it's too intense, and you lose the ability to learn because you've moved into that fear and panic zone. And so ideally we should spend most of our time in that middle zone. If you're in your comfort zone all the time, you're not.
When I was last in my comfort zone. I don't think anyone is in the world anymore.
In terms of what mental health means in the workplace, the World Health Organization have a definition of mental health, and they say it is a state of well-being of mental health. This is a state of well-being in which every individual realizes their own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to their community. So that's a nice definition of
and it's very related. I think for me, that what really sticks out in there is that sort of sense of being able to know your own potential, feel comfortable within that, but also know that you're making a difference. I think that heavily weighs into what mental health in the workplace looks like. So going away from that, then, what does mental ill health look like?
It can be anything from mild anxiety to severe anxiety to depression to some kind of psychotic episode. So it's a range. I would say that stress probably comes just before mental ill health, and extreme stress will push you into the mental ill health. There was one that I wanted to mention, and that's narcissism, because I think narcissism is a mental ill health and a kind of mental ill health that organizations actually actively recruit in. And I know there's evidence, but I can't quote it off the top of my head, that very senior people in organizations can be. I mean, again, it's a continuum.
It is.
But narcissistic personality disorder, I would say that there are a lot of them in that realm. So sometimes we encourage mental health, types of mental health that suit the agenda, and that's certainly one of them. And then I was telling you earlier, Stephen, that there's a TED talk by a guy called Sean Acker, and
I watched it. Very good.
It's very good. And what he's talking about is the link between success and happiness, and that all our lives we're taught, if you get a good education, you'll be happy. If you get a good job, you'll be happy. If you get a better job, you'll be happy. If you go higher up the ladder, you'll be happy. And we're constantly chasing this notion of happiness, that success, the more success we have, the happier we'll be. He actually turns that on its head and he says, what you need to do first is be happy, and then success will follow, which I think is wonderful. And as part of that, he talks about a way of changing your mindset into a way that predisposes yourself to be happy. And it's literally a formula you can follow for 21 days to try and change your mindset into a more positive mindset that will lead to happiness, which will then lead to success.
It's one of those things, even for me, and I think any of my colleagues. I mean, I work in sales, so therefore you're always looking to achieve your target. You don't achieve your target, you're not happy. You achieve your target, you're successful, but now you're looking for the next goal. So it's a never-ending cycle of like, how do I get to somewhere? And I myself have experienced, periods of hitting the target and then having targets go up, and then the impact that it has, or your team not carrying certain things that you're expecting of them. So then you end up in a scenario where it does have a mental health impact, and has on me personally, has mental health impacts on numerous occasions. And I just thought it's so interesting what you were saying about, or even that definition from the WHO, where it's that purpose and that sense of identity and that sense of just feeling like you belong. Then that trumps all of the hitting targets and everything else. So it is interesting trying to push back to that.
And I mean, it's very honest of you to say that you've felt challenged in terms of your mental health.
But it is hard for people to say that. And I think, and that's part of what we're trying to promote here, right? And even just you explaining it in terms of that continuum.
And I mean, if you were to say what is the extent of mental ill health in the workplace, so the CIPD which is the Chartered Institute of Personnel Development, would say that 1 in 4 people have declared themselves to have a mental, or will declare themselves to have mental ill health at some stage in their life. But that is the people who will declare.
Yes.
Then there was something from, there was an article from People Management magazine, which I'll share as part of the resources. And they say that 56%, so that's every second person, declaring that they have experienced mental ill health at work.
Yeah.
So it is incredibly prevalent. And, you know, there traditionally has been a stigma, and there still is a stigma around
absolutely.
Acknowledging mental health in yourself and others. So, you know, there's this self stigma where people won't admit that they are having challenges, and they'll make all sorts of excuses for the symptoms, and they won't admit that they actually have mental ill health. And then they know there's a stigma in society or a stigma in the workplace, so they're not about to admit that they have those challenges. And really, until we can have an open conversation about mental ill health and an acknowledgement that it's you today, but it could be me tomorrow, and that that's okay, and that we just have to manage it, we're not going to be allowing people to self-actualize and to reach their full potential in the workplace.
What ways do you think work, taking it to a more sort of practical level, I suppose, what ways can work impact mental health? So what are the things that, you know, particularly the thrust of this webinar, we're looking to leaders in workplaces. We're looking to create that kind of environment where it is okay to talk about it. What kind of things can we look for? What kind of things can really push people's mental health over the edge? Want to call it that.
Right. So I suppose, and we have talked about this, and I've certainly been doing a lot of reading in the run up to having this conversation. You know, given our audience, and that a lot of our audience will be in management or leadership positions, but also they're just employees themselves. We have, like, I've uncovered practical advice for managers and leaders, and also practical advice for employees themselves. Now, the resources that I found incredibly useful, which again I'll share. IBEC has a guide for managers in managing mental health. The CIPD have a very good guide as well. And ACAS, which is a UK-based organisation, they have some really great resources. So it's, and if you read enough, you'll see the repetition. So it's not rocket science. There are answers here. So in terms of what can managers do, I suppose what I had as number one was stop seeing the worker as the problem. You know, and sometimes they're or you're causing it. You know, there are things about work that are causing people to be ill. And I should have said earlier as well, workers themselves can suffer mental ill health. And that may become obvious if you're trained in to spot the signs. But it may be that they're caring for someone with mental ill health outside of the workplace, and that is bringing something into the workplace. So that needs to be acknowledged as well. So I suppose number two then would be creating an environment of trust where it's okay to have this conversation. And I think leaders being able to show vulnerability themselves is great. If they, like, I mean, I can think in my own family, you know, and my own social circle, there are people who currently have mental ill health challenges. So just, you know, acknowledging that empathizing and acknowledging that as a leader, that this is something that has happened to you or has happened to somebody you care about, will help to create that open communication and trust. You know, normalize those conversations about mental ill health. You know, it's not hush hush, and it's not take them to one side. Normalize those conversations. Ethical leadership. I mean, I think we need more ethical leadership.
What do you mean by ethical leadership, though? How would you define that?
Well, for me, it's leadership that is informed by ethics. So it's informed by compassion, by empathy, by caring for the people who work for you and seeing them not as a commodity, but as a valuable.
So not by the narcissistic leaders we were talking about earlier.
So move those on.
So get the
give
ethical
those a pension plan.
Give them a redundancy package and say move on.
But then there's tailored support. So, you know, for individuals who do come forward and say I'm having challenges, because it's different for everybody. You know, your level of resilience is different to mine. How mental ill health will manifest itself for you will be different for me. So tailored supports are necessary, but there's kind of general things like, and a lot of organizations I know would have this, employee assistance programs, employee counseling, cognitive behavior therapy, you know, like just having social events so that people build those social supports with each other and those friendships at work, because often it's just the, you know, being able to lean on people when things are difficult for you is really, really important.
I think it's, you know, I've seen that myself. Having the return to the office is a difficult thing for people, right? Because it's become very normalized to be sitting in front of your Teams call or Zoom call. And then it's very focused on whatever you're talking about. So you don't get a chance to just have a chat over a coffee or on your way to the water cooler. And I think that's something that I don't know what the answer to that is, but it is something that we need to try and recreate.
And build in the time for it. You know, if people are so pressured that they leave this meeting having to run to a next meeting, they're not having the time. And I mean, those conversations can be very, apart from tapping into how people are doing in their life, they can be very creative and innovative spaces where people
I think it goes back to, I mean, it seems to be a recurring theme in our conversation, but that sort of sense of belonging and that sense of, you know, when you share something that's you've learned or something that's going to drive the business forward, you then just feel better. And that's what we're beginning to miss a little bit. I feel like
a problem shared is a
problem halved. Exactly.
So more specific things then might be coaching or mentoring, you know, so that people have that one-to-one person maybe who's been around longer than them or is at a higher level than them, and that they can bounce things off, and when they're feeling particularly stressed, maybe get some tap into some wisdoms as to how to deal with that better. Spotting the signs. So, you know, when you read a lot about this, you know, the indicators of mental ill health can start to become obvious. And it could be things like absenteeism, increased absenteeism, or it could be, you know, obvious signs of anxiety, or a dramatic drop in work performance or work output, or the quality of work output. So training managers particularly into spotting the signs. And like with a lot of things in organizations, it's the first line managers that are really important. The leaders are very important for setting the direction and leading by example and being ethical. The first line manager is your first point of contact between workers on the shop floor and the various levels of management. And they're the closest to the employees, so they need to be able to spot the signs, and they need to be trained in how to have those difficult conversations and those open but important conversations, you know. And you could say the wrong thing, you could say something damaging, so that's why people need training in how to have those conversations. Jobs need to be redesigned to build in flexibility, to build in work-life balance, to adapt to the needs of the individual employee doing that job, and proper performance management. So for me, performance management is about managers regularly sitting down with their team, individuals in their team, having that conversation. Okay, here's the set of targets that we're going to agree. What resources do you need to do that? Is there any training that throws up? Where do you see yourself going in the next 5 years? How can we craft it so that you're getting where you want to be? You can come back to me at any time if it looks like we agreed to targets that were too intense or whatever. So it's that proper performance management that is a two-way conversation about how is this going? How can I help to take the pressure off you and make sure that you get where you want to do without falling over the edge of a cliff on the way.
Which I think then relates back to what you were saying of that sense of real trust, because performance management under the guise of trusting your manager, being able to say, actually, okay, I have made a mess of this, or actually you've done really well, and everything in between. It links back to that. Very closely.
And sometimes performance management gets caught up in the reward dimension.
Absolutely.
And am I a 3 or am I a 4?
Have I ticked this correct box? Exactly. And there's so much box ticking. I agree. Absolutely.
It's about that kind of compassionate conversation of how's it going? How am I doing as your manager? How can I do
no one likes to hear that part.
It's
very hard.
Well, you're paid for it.
Well, that's true.
As a manager.
That is true.
From the worker perspective, the employee perspective, the kind of things that I would recommend is, number one, find your element. You know, and sometimes you're in a job, you are a square peg in a round hole. You've got a choice. You can keep trying to force yourself to put up with that, or you can take the plunge and find a way to become a round peg in a round hole.
Okay.
So find the job that puts you in your element. Do whatever it takes to build your resilience. So
Okay.
so I have, on my notes, blue therapy. So I
Which
live
I
in,
don't know what that is.
yeah,
Yeah.
it's the sea.
Okay.
I live in Galway.
Yeah.
And if I'm feeling stressed, a walk by the coast is incredibly therapeutic. So blue therapy is water, the power of water
I don't know how I've never heard
to
that
calm
before,
you.
but that's.
I mean, it can be as simple as breathing.
Yeah.
Again, when I feel stressed, I take 3 deep breaths, and there is a biological explanation to how that actually slows down your heart rate and actually does start to make you feel like you're in control. So build your own resilience. Exercise is good for resilience. Healthy eating is good for resilience. Positive relationships is good for resilience. Get yourself a dog. So I have an obsession that's called Miss Poppy Shortstocking III, and
What is it?
Poppy is her name.
Okay.
And
right.
she is my mental health. She is my resilience builder, because if I'm stressed, she is the perfect de-stressor. But it's whatever whatever works for you. I would say, back to that stigma. If you're struggling, you have to have the courage to admit, I'm out of my depth here. I need help here. I need support. So it's having the courage to admit when you're struggling, knowing that every second person gets it at some point in their life, and so you're actually helping them as well as yourself by admitting that you have a problem. Know your own triggers. So if there are things that you have learned over your life that trigger you into that distress mode that is just before mental ill health, know what those triggers are and avoid them. Like for me, I don't work terribly well under pressure. I like to be very prepared, so I know to get myself prepared, and then I won't, but I don't like to be caught without having prepared what I need to do. So that's a trigger for me. So I know how to manage that. I just do my preparation. This one I think is a good one. See mental health at least as important as you would your physical health. I mean, people, if you have a botchy knee, people will go and get it sorted, and yet they will let their mental health go down and down and down and down, and they won't deal with it. I actually think your mental health is more important than your physical health, because I think your mind is your most powerful organ, and if that goes wrong, everything else is just going to start to fall apart. So if you're going to take care of anything, take care of your mind and your mental health first. But as I say, people tend to, if you have a toothache, you go to the dentist. If you've got, sore eyes, you go to an optician. Every morning when I get up, I come downstairs, I make a cup of tea, and myself and Poppy sit on the couch, me in my pajamas, her in her matching pajamas. I'm just kidding. And it's almost meditative. We just sit there, and she's very calm and I'm very calm, and I may be thinking ahead to the day ahead, but I haven't switched on the lights, and it's very calming, and that's meditation to me. It can be anything. Music can be meditative. Anything that just slows down your mind, I think, is meditation.
I liked how you've summarized that there is a reason why this needs attention from work, and you've got 3 sorts of arguments as to why. And I like that, right? Business brain on as a business, thinking, what are the reasons why, right? Why should we even look at this, from a very practical perspective?
So what I say to people is, if you're trying to make a change at work, if you're trying to change something from the negative to the positive, there are 3 arguments for why you should do that. Number 1 is the ethical argument. So how dare you as an organization or as a manager damage the mental health of someone who works for you? And so it's like, it's back to ethics. You have no right to send someone home from work at the end of the day with a mental health problem that is going to carry over. These are human beings, they're not machines, so you have an ethical responsibility. So number 1, and for me should be the strongest, is the ethical argument. And linked to that, when I was thinking about this, is there's a DEI dimension to it, and DEI is diversity, equity and inclusion. I'm the Vice Dean for diversity, equity and inclusion here, and now I'm everywhere I look, I see inequity and exclusion. And so part of the ethical argument is that, you're more likely, like there's advantage. So there are people who fall into the dominant white majority are advantaged. Anyone who is out of that becomes increasingly more disadvantaged. And so there's an argument for how, when you're trying to support people, you sometimes need to treat people, in order to have equity, you need to sometimes treat people differently and more favorably in order to level the playing field. So, and then the inclusion part is back to what you said about belonging. We all want to feel like we belong. And the further out you go from that dominant white majority, the more likely you are to feel excluded. So we have an ethical responsibility to include people, to treat people equitably rather than equally. And that's the ethical argument for addressing mental health. The second argument then is the legal argument. If you don't do it, you might get caught. And if you get caught, you might be in trouble. Because the Employment Equality Acts say you have to treat people equally on 9 separate grounds. And the Health and Safety and Welfare at Work Act say you have a duty of care, and you have to create a safe environment that is safe both physically and psychologically. So if you're not looking after the mental health of your workplace, and you're not treating people with decency and fairness and equity, you may be challenged. They may take a case against you, and you end up, with a whole heap of trouble that you don't want. So that's the legal argument. And then the third argument is the business case. And this is back to Sean Acker. If you have happy people who are happy, they will thrive. If they thrive, you will thrive, and we'll all live happily ever after. So it's that positive cycle of look after people. They will feel, valued, respected. They'll feel like they have a voice. That then, allows them to perform to their maximum in the workplace, and you have that positive spiral towards everybody winning. The other way, it's a negative spiral towards everybody losing, including yourself as the business owner.
I always think it's good to kind of summarize things back, right? So for anyone who's watching today, they can kind of take away a nutshell approach of what we've been talking about here. So how would you summarize where we are, where we can get to, just what we talked about today?
Okay, so mental ill health, I would say, is a critical issue for organizations. It's becoming increasingly so. It is something that will impact all of us at some stage of our lives. We need to have a more open approach to acknowledging that and to managing that. Today, we've tried to offer practical suggestions for what leaders and managers can do. We've tried to offer practical suggestions for what employees themselves can do. We will provide a list of resources that you can draw on if you want more information, and you're welcome to contact myself or Stephen at any time if you think we can help. This can be managed better. This needs to be managed better, and taking 2 or 3 steps of change is going to lead to improvement for individuals, for the workplace, and for society.
I don't know about you, but I got lost in the conversation, because like as if they were in the room here with us having that conversation. I think they even forgot that we were here or why they were doing that, because it was so engaging. I think key things that came out big time is normalizing mental health, normalizing the conversations about mental health. Lovely piece I liked, what Deirdre said was know your own potential. We push ourselves and push ourselves and push ourselves. And then because we've pushed ourselves so far, we put expectations on ourselves that we think others have of us. So it's maybe just taking that bit of time to think about that. Stigma came up yet again, and that whole area of self-stigma. And what do we need to do around that? And what would help it? And I think one thing that helps is the more awareness and understanding that we have, be it as an employee, as a manager, the more we understand and the more awareness we have, the better we can reduce the stigma and self-stigma that is there around mental health. I think, being practical. You can't take as a friend of mine says, Gina, if you're out there listening, how do you eat an elephant? You do it one bite at a time. So what Deirdre was saying, small steps, keep them small, keep them doable, keep them realistic. Integrate them into what you already have. You'll find you have a lot less to do than you think, but if you see it as being something separate, then you see it as this huge piece, that a huge mountain to climb. So I want to let you know again that the link to the framework will be put into the chat and you'll be able to get it on the web page as well at the end of today's proceedings. I know we're running over time, but I really think that what you're hearing is so valuable and has been so good. We're going to take a 10-minute break now, and about 7 minutes into it, we're going to be putting up what everybody has been putting in the chat around nature-based pieces, and we're going to have a virtual walk in the woods. Sean is joining us in person, and I think a lot of the comments that came up in the back in the chat there, Sean is going to speak to them and really tell you how they have used it and translated policy into practice within the workplace. And I hope that you will get quite a lot out of that. So we'll go for 10 minutes. So it's now almost 11:45. So if we're back about 5 to, and then we'll still wrap up by about 12:30, 20 to 1. How about that? And we can take questions and respond back to them via email as well. Okie dokie. Enjoy your cup of tea, and we'll see you back at 10 to 12.